Hello, this is Dr. Michael Marchetti. I'm here to talk to you today about negative network. What is a negative network? Well, this is one of the most important dermoscopic features if you're looking to identify melanoma. The metaphoric definition of a negative network is a serpiginous, interconnecting, broadened, hypopigmented line structure, kind of like a white maze-like structure, that surrounds elongated and curvilinear globules. So brownish globules, not so roundish, more elongated and sausage-like. Now in the descriptive terminology, we refer to this as lines, reticular, hypopigmented, around brown clods. And if you look at old literature, the negative network goes by some previous terminology like inverse network or reticular depigmentation. But these terms have fallen out of favor, but important to know if you're reading older literature. This dermoscopic feature can be seen with both polarized and non-polarized dermoscopy. And here's a really good example of a melanoma with multiple areas showing very classic negative network appearance. What's the significance of this structure? I've alluded to the fact that it is primarily seen in melanocytic lesions, but it's not a particularly common feature. So you may go many days in clinic without seeing a lesion with this dermoscopic finding. It has a strong association with melanoma, particularly melanoma arising in association with a melanocytic nevus. It can be helpful in identifying early melanomas without ABCD features. And it's one of these features where it's either present or it's not present, which actually can make it a good thing because there's no regular or irregular appearance to it. When you see it, you know it's a positive finding, and that has helped, I think, with inter-observer agreement, meaning that we agree when we see the feature, whereas with some other features, defining when something is regular and irregular can be a little bit difficult. Within the melanocytic benign world, you can see this feature in Spitz, Spitzoid, and some congenital nevi, and particularly in individuals who have a very moly phenotype, who may be on the younger age spectrum. So some individuals can be, it can be a difficult finding. You may see several lesions with this finding, and it can be very difficult to know what to do in terms of management. When we look at systematic reviews looking at how robust the negative network feature is, surprisingly, it shows a relatively low odds ratio. The sensitivity in this meta-analysis published in JAMA Dermatology in 2021 reported a sensitivity of about 35%, which I think is pretty accurate. It's not a feature that you're going to see in the majority of melanomas. You see it more in early melanomas, particularly in individuals who are moly, truncal melanomas. Surprisingly, they reported a specificity of about 70%. In my personal experience, I find that the specificity is much higher. One of the legends of dermoscopy, Harold Rabinovitz, I remember presented some data in a poster format where he reported that about 50% of the lesions that he sees with a negative network turn out to be melanoma. And I think that's closer to my experience. I think the specificity is much higher. So what melanoma subtypes do you see negative network? You're not going to see it in facial, acral, subungual, mucosal, or chronically sun-damaged skin type melanoma. You see it in superficial spreading type melanomas arising on the trunk and extremities, and some spitzoid melanomas. So that's important to keep in mind when you're examining a particular lesion. What is the histopathologic correlate? It remains somewhat nebulous. Multiple studies have looked into this with a variety of methodologies. It's not yet clearly accepted exactly what this feature is. People have reported that it relates to the nests in their distribution, the melanocytic nests, that it refers to broadened epidermal reedy ridges or elongated reedy ridges. Some authors could not identify a histopathologic substrate, and others have suggested it relates to collagen. So the jury is still out there on exactly what the finding correlates to. Let's look at some good case examples. Here's a clear ugly duckling lesion, large irregular borders, multiple colors, with one of the most beautiful examples of that negative pigment network. You see those elongated brownish structures, right? Kind of globule-like, but more sausage-like in appearance, and that white maze-like background. So good example, negative network. Here's a moly individual, right? Many nevi, lentigines, ugly duckling lesion. In addition to atypical pigment network, you see a good example, negative network through the lesion. Another more striking example of a melanoma, hard to miss on the leg, again showing beautiful negative network. Let's look at some more subtle examples. In this younger individual with atypical mole phenotype, here's a lesion that clinically really doesn't stand out all that much. Light brown, fairly symmetric, doesn't clinically have a lot of features that would clue you to the diagnosis of melanoma, but with dermoscopy, it's a very easy diagnosis. You see striking negative network, and that sort of finding in a young individual really should prompt biopsy. And indeed, this was a 0.5 millimeter melanoma arising in a nevus. Here's another individual with atypical mole syndrome. This one stands out a little bit more. Clinically has some variability in the hues of light brown and pink. Again, beautiful example of negative network throughout the entire lesion. We can zoom in a little bit closer. One thing I want to point out, sometimes the brownish sausage-like globule structures, you can see little dotted vessels through them. And you don't see them in the whitish portion of the negative network. And indeed, this was melanoma arising in a nevus, and that seems to really hold up in my clinical practice. It does suggest melanoma arising in a nevus when you see negative network. And here's a more subtle example, courtesy of Dr. Margoob at Memorial Sloan Kettering. Subtle negative network cluing you into the diagnosis of melanoma in situ arising in a nevus. Here's a very small lesion, clinically not too much to really, raise alarm. With dermoscopy, it's an easy diagnosis, right? You see negative network, and that should prompt a biopsy. Melanoma 0.25 millimeters. This was an interesting case I had a few years ago of a lady with multiple primary melanomas, and I saw this lesion had changed. It had become slightly pink in color, and I went back to a dermoscopic photo I had taken 2 years prior, and indeed it did have a subtle negative network in the center that I didn't really place much importance on at the time. You can see that as it evolved, it became a little bit pink in color with some dotted vessels, and the negative network actually was not as noticeable down the road when I did the biopsy, but was melanoma in situ arising in a dysplastic nevus. Of course, there are going to be some challenging patients. Here's a young individual with the atypical mole syndrome, where their nevi do show negative network. And these are very difficult lesions in terms of management, feeling comfortable with these. So here's an example of a lesion with focal areas of negative network, has pigment globules at the periphery, and I biopsied it to exclude melanoma. It was a benign nevus with spitzoid features. And there are multiple published case examples of this. The difficulty in distinguishing Spitz nevi and melanoma, they can be symmetric, they can both show negative network, and at times it's virtually impossible without performing a biopsy to really know the difference. There is one mimicker to be aware of that can sometimes have negative or can have an appearance that suggests negative network, and that's dermatofibroma. And in the central scar-like area, you can see these brown ring-like globules, and in some cases that can suggest negative network, but other features can help clue you in, right? The right context, a lesion on the extremities, a dimple sign, a lesion that's firm, those sort of features, in my experience, are very helpful. So in summary, for negative network, you see serpiginous, interconnecting, broadened, hypopigmented lines that surround elongated and curvilinear globules. Primarily, you see these in melanocytic lesions, although dermatofibromas can present a similar morphology at times, but they have a different pattern and context, and in my experience are easily distinguishable. There's a strong association with melanoma, strong enough that I would suggest any lesion that shows negative network, probably there should be a strong consideration to do a biopsy. And in particular, you see this feature in melanoma arising in association with nevi. You can see it in other subtypes of benign melanocytic lesions like Spitz nevi, spitzoid neoplasms, and in some congenital nevi. Thank you so much for your attention.